Hi, everyone. I am Kelly with Two Broads Talking Politics, coming at you early on a Sunday. This is unusual for us, but there's so much to talk about now. And I am thrilled to be joined by Dr. Emily Landon, who is a hospital epidemiologist at the University of Chicago Medicine. So, hi, Dr. Landon.
Hi, Kelly. Thanks for
I
having me.
Yeah, I've been saying for a while that you're my favorite epidemiologist, and people think it's weird that I have a favorite, but
Nowadays, we
nonetheless.
all need a favorite epidemiologist, I guess.
So I had mentioned on Facebook to my friends that I was talking to an epidemiologist and said, "What are your questions?" And I got like 10 million questions at me. So we might try to get to some of them. I would also recommend that people listen to the latest episode of In the Bubble with Andy Slavitt, because he went through a lot of the sort of nuts and bolts kinds of questions about how do we survive the winter. So a lot of those things may be covered elsewhere, since we probably can't grab you for a weekly show like it seems like maybe would be warranted. So first, I just want to start by saying thank you for everything that you are doing and that healthcare workers all over the country are doing. I know in the spring we had a lot of like, yay, healthcare workers are heroes, and people seem to have, fallen off of doing that quite as much. But this is such important work. And I just want you to know that we are very, very grateful.
Thank you for saying that. It is really hard right now. The healthcare workers that I know, I know many of them, are really struggling. It's hard work. And they've run a marathon, had not really a break, and now they're running another one. And it's kind of getting dire in the hospital situation in Illinois. And I know that there are other states that are even worse off than we are here.
What, besides just thanking the healthcare workers, we know, are there sort of practical things we can be doing to help healthcare workers to, either try to stay out of their hospitals or, sort of things we can do to be helping with PPE, or, what's the best way we can be supportive?
Wear a mask. Don't have too many gatherings. Don't spend time with people outside of your household. I mean, the public health recommendations are there to help protect us, but there's been way more politics in public health this year than I've ever seen in my life. And I just don't understand. I mean, I think we're going to talk a lot today about how that has played a role, that's done. But it's meant that a lot of people are not following the public health recommendations, and that's what's getting us where we are. It's raised the risk for every single one of us. You can do everything right and still get COVID. We need everybody to do everything right in order to really drop the sort of temperature on this a lot.
Yeah. So let's talk politics for a minute. We just had a presidential election, of course, along with a number of Senate and House and all sorts of other elections around the country. But one major change, of course, is going to be who is in charge of the federal response to COVID. Up until now, we've had essentially zero federal response to COVID. What could a good federal response look like? What we see so much about what governors and mayors and things are doing, can do, but what difference does it make to have a change at the top, at the federal level?
Well, I think I've learned a lot about how powerful the presidency is. I mean, of course, lawmaking is balanced and even executive orders can be challenged in courts and that sort of thing. But the bully pulpit, or the ability to speak to the American people and have your followers, your supporters just believe what you say because you are the president, is incredibly important in shaping culture. And so even if I'm really hoping that having some positive messages going out, having leadership from the top, just with the appropriateness of the messaging, will be really, really important. That said, there's a lot more that can be done. First of all, the Defense Production Act can be used to make more tests and more PPE. Things are better than they were in March, but they are nowhere near what we're going to need to meet the goals if things like the IHME models are correct. We also need better sort of instructions. The rules actually, the federal government's recommendations that the White House put out about how to address this pandemic actually are not awful. They're not really stringent enough. They're not what I would recommend, but they are not awful. It's just that we aren't following them and that the federal government is not encouraging people to follow them. And so they're saying one thing and doing something completely different. And that dichotomy is really playing a big role in how different states respond. You know, the president has created this situation where people who are following him have to do it the way that he wants it done, not necessarily what the official rules are, or else he will take them down or harm them in some way. And hopefully that his sort of hold on them will diminish and they will feel like, well, I guess I do need to play along with the federal government and they are going to back up what they tell me to do. So I better start thinking about doing it. You're already seeing plenty of Republican down ballot, sort of Republican governors, Republican mayors looking at the situation in their city and saying, yeah, mask mandate. And so that sort of thing is, you know, going to make a difference because the same people that are supporting Donald Trump are supporting these people. And when they're local politicians, I was listening to some of your other podcasts and, you know, the down ballot races are where all politics is local, right? Mm-hmm. So I think they really matter to people. I think they may think that what Trump says really matters, but that's because there's a vacuum below that. But when there's a vacuum coming from Trump, which we've seen actually for the last week, then the down ballot people can say a lot of things. So I think Biden coming in and saying, you need to have a mask mandate if you have more than 2% positivity, you need to be doing X number of tests per 100,000 population per week. You need to be doing this. And if you're not doing it, we're going to give you the resources you need to do it. You need to have, you know, this is when you should shut down these kinds of businesses. You shouldn't open restaurants and bars, but here's some, we're going to work hard to find a way to support restaurants and bars. I've known since April that restaurants and bars were not going to be able to be opened for about a year. And there is absolutely no reason why we can't pass legislation, some sort of support for these individuals. I mean, if you're going to take an entire industry out for a year, we should do something to support them. Yeah. So Defense Production Act, appropriateness of rules and sort of the way that we work is sort of backing up the rules with the messaging and with the support, and then supporting industries that just can't operate right now, and then prioritizing, making it a clear policy to prioritize things that are essential, like clearly making schools an essential service as opposed to bars and restaurants. Not that bars and restaurants aren't important to our culture and our society. They absolutely are. We need to bridge them over. Kids need to keep going to school if they can. And of course, some can go, you know, virtual school is not all bad, but it's not all good either. And, you know, there needs to be better support for that sort of thing. So I think changing the narrative too is going to be really important. But there are a lot of little nitty gritty things like that can be done, levers that can be pulled that can only be pulled on a national level.
So one of those things that I think we're all looking toward is vaccines. So we got good news about a week ago now that the Pfizer vaccine appears to be doing pretty well. It appears to be pretty effective. Whether or not it's absolutely as effective as they say, you know, remains to be seen. But what is that going to look like? A rollout of a vaccine or multiple vaccines, it might be. You know, how is that going to play out? How long is that going to take once we are sort of at a place where we're ready to share those? You know, and what does that really mean in terms of when we can get back to quote unquote normal?
So this is first of all, I want to say this is actually an example of something that Trump didn't do badly. The Project Warp Speed actually did really support the development of vaccines quickly. And the corner cutting on that is largely red tape and bureaucracy. There's a ton of red tape and bureaucracy in getting a drug approved, getting a vaccine done, and it's appropriate to cut that out. The other thing that it did is it took the production of the vaccine, which is very, very expensive, and wouldn't happen until after it had been approved and takes a long time. And they made it go concurrent with when the vaccine was being tested. So you make millions of doses of the vaccine before you even know if it's going to be acceptable or not. Now, then theoretically, this program would then, if the vaccine didn't turn out to be effective, then you would just dump those doses and throw them away, and it would be a loss, but the government would have paid for it. It would be worth it. That's an investment that's worth it. Now, whether or not, I think if the Trump administration was going to stay in office, I'd be very concerned that they would push for all of these things that we'd, even if they didn't do well, that they would become available. But I don't think Biden will do that. And I don't think there's any chance that Trump can mess that up before January. So I think that's okay. The ones that are going to come online first are the ones that are the most effective, that are the furthest ahead. And I think that includes this Pfizer vaccine, the Moderna vaccine. There are a couple others that are sort of right behind it for early of 2021. So both the Pfizer and the Moderna vaccine are ahead because they are what's called mRNA or messenger RNA vaccines. These vaccines are very quick to develop. And but they cost a lot to make, and they still can't be made. I mean, none of this stuff is like, it's not like putting vinegar and baking soda together in your kitchen. It's a little more
Darn.
I know. You got to do a lot of work. So they've made millions of doses, but they haven't made, there's 300 million people in the United States, and each of these vaccines requires 2 doses. So one will get approved probably by the end of November, beginning of December. The other one will get approved probably the end of December. Pfizer, we've seen the interim analysis, and they're saying 90% effective, but that's not a ton of actual outcomes. And so we have to, that's probably the ceiling of the effectiveness, but I didn't expect the ceiling to be that high, so that's very optimistic. Then the Moderna vaccine, we haven't seen the interim analysis, but they're similar, so we expect that maybe it'll work just as well. Hard to say. We'll find out. They will be available. We're actually taking pre-delivery of those, so they're distributing them ahead of the approval to places that can store them. So that's where there's the difficulty. You've been hearing about this extreme deep freeze necessity for these vaccines, and that's true. That's not hype. They need to be stored in what's a -80 freezer, -80 Celsius freezer, which are commonly used in labs and in not hospital labs, but in research labs. We have one in our infection control lab. It's where we save samples. It's where we put stuff that needs to be kept for a long period of time. But not everybody has one. So your average urgent care center doesn't have one. Parts of the hospital do not have them. Our labs have them in academic medical centers, but a small community hospital may not have any -80 freezing. So we at the University of Chicago have a ton of them because we have a lot of research labs. And so we will actually use that space as storage. Everybody's been able to allocate, I've got this much space that you can have to store vaccine. And so, usually we wouldn't want to store human products in these other freezers, but you just package them specially and label them and put them in there. And, you don't open them, you just put the whole box in. And so we'll take delivery of a lot of vaccine in the next week or 2 and store it. The real concern is keeping it cold enough during the travel and making sure, because if it gets above a certain temperature, it's inactivated. And so having millions of inactivated doses is not good. So then there's the piece about getting it from the freezers into arms, right? Mm-hmm. So the first round will go to healthcare workers. And this is reasonable, not just because healthcare workers are on the front line, but because healthcare workers there's a lot of vaccine hesitancy. These are new vaccines. Healthcare workers have a slightly better understanding of what they're getting into by doing it. And they expect that healthcare workers will be able to kind of lead the way and be more likely to accept the science. And then that'll help other people to be more accepting of the vaccine. Then it will go to higher risk individuals. But the actual process of getting it from the -80 freezer, you can only have it at up to room. You can only thaw it right when you're going to use it, basically. And so it has to be kept in these dry ice containers, and you've got to replenish the dry ice regularly, but they can be stored in the dry ice for up to 10 days or something. So your average clinic will get a box full of dry ice and vaccine, and then there's all these rules. And if you don't change the dry ice all the time, it's going to be messy, and you've got to use those doses within a certain amount of time. So the first dose will be easy, whoever comes in. But then when it's time to do the second dose, do you give somebody else a first dose, or do you give a second dose to somebody? And how do you get them to come back on the right time?
Yeah.
It's going to be a little tricky. That's why healthcare is a little easier, because they're there at the place. You just administer them to people that are there. So I think we'll learn a lot from that aspect of things. It's going to be logistically challenging.
So do we think that the vaccine's going to be effective? You talked about the sort of ceiling of effectiveness. Is this going to be, or do we know yet? Is this going to be like a flu vaccine that you have to get every year? Is the virus mutating in ways that might mean a different vaccine over time? Like, do we even know these things yet?
We don't know any of that. We know that they're working, but remember, we've shortened the timeline of checking the effectiveness, so we don't know the horizon of how long that will last. And based on the sort of what we're seeing in terms of immunity, it's probably going to keep people through the winter. And if this is a seasonal virus, I think what's going to end up happening eventually is that it'll be co-formulated with the flu vaccine, or you'll get it when you get your flu shot and that sort of thing. But I think the important thing to know is that they're still going to be like the flu shot. There's going to be some people who aren't protected, even though they got the vaccine. And we don't yet know whether the vaccine gives you like a milder disease if you do get sick. We don't know the answer to that yet. Or if you just get no immune response and then you get exactly the same kind of infection you would have had. So I think it's really important that we think of these vaccines as an additional layer. So we think of masks, distance, clean hands, ventilation. All these things are just layers of protection. None of them is perfect, right? But if we put them all together, then they become a pretty thick safety net. And this vaccine, as it gets distributed, will be added to that. It'll be another layer, but it'll be a layer that is easier to fill in, right? The gaps in the vaccine will be huge at first because only healthcare workers are going to get it. It's not really good, it may not be 100% effective, but as more and more people get that vaccine, and it's sort of a one-time thing, masks are excellent, but people just aren't wearing them when they need to be wearing them. And they have to eat. People have to eat. It's a thing that happens. So, this vaccine is a little bit easier from that standpoint. Logistically hard to get out, but once you get it into people's arms, it can make that layer will get thicker and thicker and thicker over time. And then we can start thinking about taking away some of the other layers. But in the meantime, you need to think of it as an additive, as something that will help get us out of the mess that we're in. And we should talk a little bit about what levers there are to pull right now to get us out of the mess that we're in, because the mess we're in is awful. But the bottom line is we don't know if the virus is going to mutate in a way with the spike. Most of the effective vaccines are for the spike protein. So we just don't know if the virus is going to mutate in a way that will make us need to change that. But obviously, we now know that some of them, especially these mRNA vaccines, are able to be turned around in 6 months or so. Mm-hmm. So theoretically, we should be able to do that like we do with the flu vaccine.
So I'm glad you mentioned the layers, because I think that was when I say that you're my favorite epidemiologist, that's part of why, because that's, I learned sort of the layers from you. And you mentioned sort of what those layers are, things like masks and washing hands. I assume things like washing hands are things we should just keep doing forever, even when COVID is maybe not quite so dangerous.
In my non-COVID life, I actually study healthcare provider behavior with respect to habitual tasks, and it's mostly hand hygiene. That's like literally, I've devoted my entire life to hand hygiene. So please keep washing your hands.
So, how do we think about those layers in terms of still going about our daily lives? So there are still things people need to do, right? They need to get groceries. They need to get their prescription medications, and we know more now than we did in March about what's safe, how to do those things safely. So what's sort of the everyday approach before we all get a vaccine to those layers and to staying safe?
Yeah, so back in March, we didn't know anything. Just like I'm telling you now, we don't really know how long the vaccine's going to last, or whether or not it's going to work, and all this stuff, or how we're going to get it out to people. We didn't know whether or not your groceries were safe, or your Amazon deliveries were safe. Now we know a lot more. So CDC, for all of their I'm going to say they've been wet blanketed a lot in all of this, but they have also been they've been busy doing some work, and they've assessed this risk factors. They actually did what's called a case control analysis, where they talked to thousands of people that were coming in to get COVID tested in a number of different places across the country. And they asked them about all their activities in the 14 days prior. Then they kept track of which ones got positive tests and which ones had negative tests. Mm-hmm. And so all the people and then they compared what the activities were different between the people that had positive tests and the people that had negative tests. Everybody went to the grocery store. And in both groups, there was no difference. Whether, some people obviously ordered groceries, and some people didn't go to Target, some people did, some people, whatever. But there was no difference. So in the two groups. So we know that effectively going to the grocery store, going to Target, picking up, getting mail packages delivered, that's not increasing your risk. What was different was the individuals who ended up with COVID, especially the ones who didn't have a known contact. So people who didn't have a sick family member at home were much, much, much more likely to have eaten in a restaurant, been to a bar, and there was a big trend toward having been in a gym. And there's growing data now since then about these things. We hear outbreaks associated with bars and restaurants. So what it comes down to is and you heard about the singing and choirs, and you've heard about some spins, soul cycle classes. And so I think I don't want to throw the wrong company under the bus here, but it's not their class. It's just the activity itself. Right. When you are either singing, talking loudly, not like what we're doing here, but like really shouting and or exercising, you increase what we call the minute ventilation, the amount of air you're moving, and that makes more droplets. And it makes the droplets smaller and more likely to stay in the air longer, especially the vibrations from singing. And the other thing that does that is colder, drier air, which is a big reason why we're seeing so much now. But those activities, even when people are wearing masks, if there's not enough distance and there's not enough ventilation, it may not be good enough. So that's part of the issue. Plus, a lot of times people don't want to be wearing masks when doing those activities because it feels weird to sing with a mask on or exercise with a mask on. I know everybody's had that experience. Yeah. But eating and drinking, you definitely can't wear a mask. And here's the piece that is this is what's driving this growth. What makes, I hear a lot in the trolls on my Twitter account, it's just a seasonal virus. That's why it's building up. Not having anything to do with masks. But seasonal viruses are seasonal for a reason. They're not seasonal because they like December. They're seasonal because the situation changes and makes transmission more favorable. And the situation that changes is that dry air or cold air can't hold as much moisture. And our HVAC systems are great at heating that air up, but not at adding back in moisture. That's really hard to do effectively without growing a bunch of mold. So you end up with, when it's humid out, your droplets coming out of your mouth are real juicy, and they stay juicy, and they fall. That means that they're heavier and they fall closer to you, and so most of the transmission has to be within 6 feet. But when you have drier air, more of those droplets will dry out faster and be able to stay aloft longer and linger more in the environment. And then you have people, so that's a problem that literally makes COVID more contagious in the winter. And then you have the problem of indoor ventilation. So we have spent ages trying to make our indoor ventilation as absolutely economical, as eco-friendly, as efficient as we can. And we are great at holding in hot air and using less energy. Unfortunately, it also holds in the COVID, right? And so we're often recirculating the air and not putting it through really, pushing air through HEPA filtration is actually harder. Your machine has to work harder, use more energy. So you're not set up for COVID is what it comes down to. No buildings are, except for hospitals. And so you just don't have enough fresh air being mixed in with your air. Whatever building you're in, doesn't matter. You're just not mixing in enough fresh air. You don't have efficient enough filters in your home or in your buildings. And so you put people inside, they say, I had a barbecue outside in July and it was fine. Everybody was, when we were eating, we were just 6 feet apart. And that's great. They say, well, I'm going to do that inside. I'll just keep us apart. But all of a sudden, 6 feet doesn't matter, because when you've got your mask off for an hour, that room, if somebody has COVID, that room fills up with COVID and everybody can get it, even if you're more than 6 feet apart. And so that's what's happening. It's not that people aren't wearing masks to the grocery store. We know that if you just wear a mask at the grocery store, everything's going to be fine. The problem is they're getting together in homes. They're going to restaurants, and restaurants have had to close windows and doors. Now they're, of course, not open in Illinois, but in other places. And so you're seeing that pushing it around. I think that's also, we're starting to think that that's what happened in the summer in the southern states. People were indoors because it was too hot, and the air conditioning was moving things around, and people weren't wearing their masks indoors. They were just counting on distance, even though things were really closed up, which kind of makes sense. There's still a lot of data that's biologically plausible, but there's still a lot to learn to know exactly what happened. But
So I think the layers, people think about masks and hand washing and distance, of course, is something that's been drummed into us. People don't seem to talk as much about time, the
Ah,
amount of time that you are with people.
sure.
I think I heard you say the other day that it's probably safe to go to Starbucks and quickly get a drink and leave, which is still something that scares me
No,
because individual risk is hard to figure out. But how does the time factor into that?
so when you have your mask off indoors, time matters a ton. So it's all about time and distance. So what we know is that if you have your mask off for 10 minutes and you eat something really quickly in a room with other people, there's not enough droplets to make that room. The droplets will dissolve or distribute equally into the air. Well, somewhat equally. I don't know. It depends on the ventilation. But the point being, they get diluted by the air in the room, and you have to get a certain amount in order to get sick. So that's a really important piece, the amount of time. But if you leave that mask off for an hour, so we tell our healthcare workers that they need to eat, they can go in there, they can eat in the break room, but they have to do it in 15 minutes. It's a race. And so if you're going to be getting together with your family for Thanksgiving, you can all sit around the table and talk for as long as you want with your masks on. But if you're going to eat, you need to eat quickly and then put your mask back on.
Which is not how people eat Thanksgiving dinner.
No, it is not. But it is better. And if you absolutely need to get together, but you're still worried, that's a way to sort of mitigate the risk. I don't know. It's just, it's about it when you're talking about a finite amount of air, which is any indoor space, it's time and distance. And those two things matter. So if you're close up with someone for even a short period of time without their mask on and they've got bad COVID, you're kind of screwed. But and it really does need to be more than a couple minutes. Like just passing somebody on the street is not enough. But 5 to 10, 15 minutes really close to someone might be too much. 15 minutes is what we use, and that's probably good. But more than that, if it's 15 minutes and you're 6 feet away inside a big room, you're probably okay. But once it gets to be like an hour, then you might not be okay anymore. And so that's where the time counts. Although outdoors, I would say masks or distance, and I would count time as is relatively irrelevant. 15 minutes or more is just too much to have either one or the other. You don't need both. You just need to have one or the other. And that's why socially distanced outdoor picnics work fine. Indoor picnics, socially distanced, do not. It would be fun though.
So how is all this playing out in schools? I mean, I think I, for one, was sort of terrified that schools were going to cause huge outbreaks, and it doesn't look like that is happening. You have experience looking at a university level, what universities have been able to do to put things in place. What are the sort of reasons and ways in which schools are kind of less scary than we thought they might be?
So it's all about so there's two things with gathering people together. One is how much risk those people have when they walk in the door. Like, what's the likelihood that they have COVID? And that comes entirely from the number of unmasked contacts that they have outside of the gathering that you're putting together. So if people have, we've been telling the college students that they need to have fewer than 5 unmasked contacts in their life over the course of a week. That's not at one time. So I think people mistake the gathering rules of like, you couldn't have more than 10 people together as sort of so I can have 10 people anytime I want and it'll be okay. That's not how it works. The reducing your risk before you go to a gathering is about cutting back on your contacts. And we think 5 in a week I think it's both too much and too little. So there you go. It's a good number. Right now, it's probably too much because there's too much COVID going around. But it's probably a reasonable number. It was probably a reasonable number a month ago. Okay, so then once you get the people together, you have to assume that a certain number of them have COVID. And once you accept that and decide not to worry too much about whether or not they have COVID, but worry a lot more about making sure it doesn't spread, that's the goal there. And so we can do all kinds of things to mitigate spread. I know that because I run the infection control in a hospital where we literally welcome the sickest of the sick with COVID and let them be in their rooms without their masks on. And we send people in to have really close contact with them. So I know how to stop people from getting COVID, even though they have close contact with people that have COVID. And so we can do that in schools. We can do that in dorms. We can do that in universities. You can't do that in regular everyday households where like 4 roommates are sharing together in the off campus. That's where we've seen the biggest spread, is it just seems to go right to the whole household. And then if that campus, like that, those people living together have dinner with another housemate group, then it's, everybody gets it. So it really comes down to managing the time that they're unmasked. And that's really, in universities, it's bathrooms and like dorm bathrooms, because you had to brush your teeth. Excuse me, early on Sunday. And eating. In elementary schools and high schools, which we're also working with, it's really about the eating. But and I'll get to that in a second. So in a university setting, we just have everybody in single rooms in the dorms, and we've done beautifully. And we test them every week just to make sure we're not losing track of anything. But to be perfectly honest with you, the situation at most universities where they've got things under control and people are largely following the rules when they're on campus is not too bad. It's the off-campus groups that are getting together more and doing more things. And then eating, we have people in our dining halls 8 feet apart with, in some cases, dividers and really increased ventilation. And when you're sitting 8 feet apart from somebody else, you're not going to linger over a meal and have a long conversation with them. You're just going to eat and get out. And that's what we want to do. It's a nudge to push behavior the direction you want. Same thing's happening in elementary schools. Like I'm working with Lab and working with some other schools, and their plan is very similar. It's about, the kids wear masks all day, the teachers wear masks and face shields. When the kids need to take their masks off to eat, they're put as far apart as they can. The ventilation is maximized. Windows are opened in some cases, and they're encouraged to eat really quickly, which isn't hard with, 4-year-olds. Some 4-year-olds, but you can just you would just say, time to put your lunch away, and that's it. But the issue really is the older kids, high school kids that don't live at school are a lot like the off-campus students in college. Like they're participating in a lot of activities, sports, contact sports, dance classes, music things, or just their friend groups. They have their bubble, and their bubble may be slightly bigger than it needs to be, and everybody in their bubble may be having a little bit bigger bubbles than they need to be having, and you end up with having higher risk of those individuals coming in, and you can't separate them as well as you can littles. So littles can be put into pods, like 10 people in first grade, and you just do everything together, but in high school, that's not appropriate. You have to, you can be great at humanities and terrible at math, and you need to be able to excel in humanities and be in remedial math. So you need to be able to accommodate people from that standpoint. So that's different.
I don't know where you are, but I'm hearing lots of sirens. So every time now I hear sirens, I'm in Chicago, and yes, every time I hear sirens now, I'm like, what's happening outside?
I don't have them. I'm in the South Loop. Are you in Hyde Park?
I am in Hyde Park. Yeah.
So I don't know what's going on.
I mean, who knows? We hear sirens all the time now. So one thing I know you have talked a lot about, and this sort of gets at it when we're talking about schools, is the idea of spending your risk, that each person has sort of a certain amount of risk that they can spend. And that was very helpful to me. I'm a person who's just sort of terrified of getting sick in general. And so, for a lot of the beginning of COVID, I was just like, don't leave my house, don't do anything, and the idea of spending my risk let me sort of say, okay, well, if my kids are not going into a school building and I'm not going into a work building, then that risk can be on seeing family members. And we can think about it that way.
Yeah.
How does that change now when we're at a situation in this country with, nearly 200,000 cases a day, depending on where you are in a state or city, it might be even more. Sort of, does that change the sort of individual level of spending risk?
Yeah.
And how do you think through that?
You have to turn it down. You can think of it as spending your risk or spending your contacts. This is that, how many unmasked contacts can I have? Right now, people should not have any unmasked contacts outside of their household. People that live alone can choose 1 or maybe 2. But you shouldn't be having unmasked contact with anybody. And when you go, I cannot emphasize enough, when you eat in the same room with other people, it doesn't matter how far apart you are, they count as unmasked contacts. Yeah. And you need to have, and that 1 or 2 is not at a time, that's over the course of the week. And that's how you have to spend your risk. So yeah, you want to limit your risk, because there's a it's a great little, the Georgia Tech put out this thing that says, that shows like what the likelihood is of somebody in a group having COVID in every zip code or every county in the country. And you look at Cook County and it's 10-person group, there's a 30% chance that somebody has COVID. Now, those are obviously average numbers, right? And so it's different if you're the person who is like you, Kelly, and you're, mostly staying at home and very concerned about this and not having any other unmasked contacts, that risk goes down dramatically. But if you're a 25-year-old who's been going to parties every weekend because, or who's decided that you don't think that you're really going to die, so you might as well just get it, then, that's a little different. So I think that you have to, you can use those tools to help you understand what is the risk and then sort of decide for yourself. But that risk spending is really important as we look to the holidays, because we're all going to be in a position to take on a little bit of additional risk. And how much of that you want to have going into your holiday celebration, if you're going to have one with other people, really depends on what the other people are going to have in terms of risk and what their risk of a bad outcome is. I mean, first of all, it's a gamble. Even young, healthy people have bad outcomes, period. Mm-hmm. There's no way to get out of that. And I'm sorry, I can't understand that we have young, healthy people dying of COVID, and or young, healthy people in our ICU and in every ICU in America, and they thought they were going to be fine and they didn't think they were going to get it. And that's just not, it's not something that we want to see. But so spend your risk wisely, because we're all taking on some risk. It's just that you should, I think that COVID fatigue makes people, makes decisions about your risk for you. Mm-hmm. And I think the most important thing we can do is to acknowledge that we have COVID fatigue and then decide that we're not, or we are going to let it make the decision for us. Because when, the last thing you want to do is be laying in an ICU bed and regret that you, went out to dinner with somebody. And you really don't want to regret that you brought COVID to your family Thanksgiving and someone died. I have talked to so many people who've been in that situation where they say, I thought I was doing everything right. I didn't think I was high risk. I only had lunch with one friend and she was fine. And then I went to a family birthday party or a family get together, and now my dad is dead. And I feel responsible because I also had, that sort of thing. And those stories are not rare. And they're going to be so much more common after these holiday get-togethers. Yeah. So many will get together and have nothing happen. And they're going to be all over Twitter, and they're going to be all over Facebook, and they're going to be all over the news, and they're going to be like, everything's fine. We got together, we didn't wear masks, and nobody got COVID at our house. And then there's going to be those sob stories that you see on CNN and on MSNBC, and they're going to say, we did get together. We thought we were fine. We weren't fine.
Yeah, I think, the one thing that makes COVID fatigue a little bit easier for me is this vaccine news, is this idea that, maybe we are getting to a point where 6 months from now, a year from now, we will be able to get together, and there will still be some COVID out there, and, we'll still need to be careful in various ways, but we'll be able to get together. And so, can I put my life on hold forever? Maybe not. Can I put my life on hold for 6 more months? Sure. Yeah, I can do that.
Yeah, it's longer than I ever thought I was going to have to put my life on hold. I didn't want to do this at all, but it's something that we could do. This is just I think I take a lot of comfort from sort of looking back in history at seeing what people went through during the Great Depression, seeing what families sacrificed during the First World War, the Second World War, and understanding how this completely changed lives for millions and millions and millions of people, and how they got through it. My grandparents were were part of the Second World War, and they may not be alive now, but their lives went back to something okay. Like they were all right, even though they had this as part of their lives. And so we have to look at this as something that's going to happen. I hear a lot. I understand that even children are suffering quite a bit from this. It's really hard for everyone. And that is not wrong. That's 100% true. But it is also true that this is going to we are going to put this behind us. It may not be, I really hope it's 6 more months. That would be awesome. And I think 6 more months is actually looking pretty good. I think by next summer, we should really be seeing a lot more normalcy in our lives. And the weather change, the vaccine, the politics change, all of that is going to move us in that direction. And so I think that's really positive. But children are resilient, adults are resilient, humans are resilient. We are going to go back to normal, and we're going to talk about, oh, do you remember when we had COVID? and kids, kids that are behind in math are going to catch up in math. And kids that are behind in reading are going to catch up in reading. And adults who have lost their jobs are going to get new jobs. That is not to say that it is okay for them to be without jobs and not have any support or any help. But we are going to get through this, and times will get better.
My own kids, who are 9 and 6, have developed their own language. They've been spending so much time, just the two of them, that I think they think now together on the same wavelength. So I think they'll actually have pretty good memories. I know there'll be a lot of people that'll have bad memories of this time, but I think my individual kids, they'll be like, it was this fun day camp time that we had.
Yeah, it's going to be really, everybody's going to look back, but the suffering that we have right now is temporary. I mean, this is going to sound a little Buddhist, but this is, we are all suffering in different ways, and we are all going to make our way past the suffering. And we have to just accept that there is some suffering. And the answer to fixing that suffering is not to just ignore COVID. I mean, that's the president's answer right now is, well, if I ignore it, it'll go away. But at some point it'll go away. And then I will have been right. It went away. Which is a really interesting way of looking at things. I'd prefer to save some lives in the process. And, I guess you could decide to just, look the other way and ignore the risk. But I think there are a lot of people who are doing that wouldn't do that in any other aspect of their life. Yeah. And it's not fair to tell them that it's okay to do that here, and this isn't just about your own personal risk. That's the other piece that I think is really hard. If we all were able to come together on this, then we could save a lot of people, not just ourselves. It's not about me protecting myself or you protecting yourself. It's about doing what's right for everybody.
Yeah. So I don't want to keep you forever, because I know that you have a very busy life right now. I do have 25 more questions I could ask you, but I think I have maybe 2 more that I want to get to. And one is, what do we do right now? Who do we trust right now? We've got 68 more days until Biden and Harris are going to take over, and then things are going to change in certain ways. But we're all living our lives for the next 68 days. Who do you trust for information right now? Who should we be listening to? How should we sort of know what we should and shouldn't be doing?
Well, as excited as I am for the Biden administration to come in, and as optimistic as I am that they're going to do better and that we're going to see vaccines, 68 days, you said? That's a really long time.
Yeah.
The newest models suggest that 200,000 more Americans will die before January. And that we won't hit the peak of this surge if we don't change things, that we won't hit the peak of this surge until the end of January. That means the numbers will just keep going straight up. Now, there are things we can do, but they are things that are hard to do. They are not getting together for Thanksgiving, not getting together for Christmas. They are wearing masks whenever you're with anybody else, even including your closest family and friends. They are closing down your bubble and staying home. They are, hopefully, they are not having stay-at-home orders, because we don't need to close Starbucks in order to save lives. We need people to stop having coffee with each other in their own homes and not wearing masks. And no stay-at-home order is going to fix that. However, there's this really surprising and terrifying thing that people are saying, that they if it was bad, then they would do another stay-at-home order. And that is, I think, going to result in people needing to do it. And I think it looks like it's getting so bad that we may need one in order to because we just have to cut back on the contacts somehow. And if that's closing workplaces, then it's closing workplaces. I mean, I don't even know, like, it's such a big loss to take for the impact that it will have, but you have to have an impact because healthcare can't keep up if we don't do anything. So I think in the meantime, who to listen to? Choose people that you trust. So I think Anthony Fauci's been really on message about this the whole time. I think he's very moderate, actually. I think that the CDC is missing some of their voice. I think it's really hard to know. They are way behind on some of these things. Their newest thing that says that masks can also protect you, there's no new data for that. That's been known for months now. They're just only finally able to publish that. So I think, obviously, when you hear something new from the CDC, you should definitely, I think I would mostly trust that unless it doesn't seem to be consistent. I think your local public health departments and your local officials are really the ones that understand what's going on. They see what's happening in hospitals. They're talking to people. They are seeing what's happening with their constituents, and they are the people that I would look to for advice. I think our governor is doing the best job he possibly can. I think there's a lot of pressure on him not to do another stay-at-home order, but I think it may be necessary. I have been actually pretty impressed with how he's been thinking about things and how much he wants to understand and do what's best for everybody, regardless of how much people don't like it. He was one of the first to do a mask mandate. That's really made a huge difference for us in Illinois. But I think those are the people that I would listen to. I mean, I'm hoping that you feel like you can listen to me. I'm certainly going to be out there talking and giving advice through all of the different media ways. You can look to your local hospitals, usually often have good advice, but your local public health departments, you can find your counties. If you're in, every county in the country has a public health department. And so you can look to your own county public health department as well.
And then my last question is just what else you think we should have talked about or be talking about?
Well, we talked about the levers. I think all the levers that are left are individual behaviors. So the models are saying, I want to make this crystal clear. The models are suggesting that if we don't do something else, that this is going to be so bad that people getting care for other problems like heart attacks or appendicitis won't be able to get care because there will not be healthcare professionals, beds, or equipment to care for them. I don't think that people really understand how close that is. I don't think that people really believe that they could go to a hospital and be told, we can't help you. I see on Twitter, I get a lot of trolls, and I try and read some of them so that I can understand where people are coming from. And they say things like, well, you'll just set up a field hospital and then everything will be fine. They weren't even really used the last time. The reality is that we don't have the people. So there aren't the healthcare workers. We have lost healthcare. So Wisconsin is struggling mightily. We've had people quit to go and work in Wisconsin where they're offered more money. We do not have agency staff that we relied on heavily in the first wave because Chicago was affected so badly, but many of our rural areas and the other states nearby us were not as affected. And so we were able to get staff from those places. This is so much more widespread. These small rural community hospitals cannot handle this. There's clear evidence that the likelihood of surviving COVID is associated with the ability, the sort of technical capacity and the greatness of the hospital they're at. And everybody wants to be in the University of Chicago's ICU. They don't want to be in a small hospital in rural, Illinois ICU recovering from COVID because they're less likely to survive. But we don't have any more. We can make more beds. We can put people in hallways. We can put people in our post-anesthesia care unit. We can use operating rooms as ICUs. We can do all of that. We don't have people to care for them. They're in North Dakota, they're asking nurses with COVID to work because they need, as soon as they feel that they're up to it, that they can manage a shift, They're asking them to come back and care for patients because they don't have enough people. We do not have enough people. Every hospital in Illinois is beginning to think about canceling elective procedures. These elective procedures aren't all that elective. They are cancer surgeries. They are things that can't wait 6 months for a vaccine to really work. They can't even wait 60 days for Biden to come into office. And when Biden shows up in office, he's not going to be able to immediately turn on the switch and have, randomly generate a bunch of healthcare workers. And you can't take a nurse that works in a clinic and put them in an ICU and expect them to do the same job that someone who's an experienced ICU nurse. Same for doctors. This is absolutely real. And I saw an article on Friday that some people tried to break into a Utah hospital because they thought that everyone was lying about how full it was. And they tried to break in and see how many beds there are. This is where we are as a country. So the one thing that you can do, and everything left to do, is on the individual. It's on you, it's on me. It's incumbent upon us to wear masks where there isn't a sign that says it's required, where there isn't an employee stopping you at the door. It is incumbent upon us to wash our hands. It's incumbent upon us to change our plans for Thanksgiving. It's reliant on us to be more careful than we have been, even though we feel like we've been more careful than we ever have been in our entire lives. That is the only thing that will shift this. And we are well on our way. And there is actually, we will get to a point where healthcare is over. We have already in some states, and we will get to a point in Illinois. Even if we changed all our behavior today, it takes a couple weeks for us to see the numbers change. So we will see things get worse no matter what. I'm hoping the warm weather from last week will give us a little bit of a cushion for a week, but that it's not going to be like cases drop. It's hopefully maybe it'll be a little better, but I don't know. It's the only thing left to do is for you to take additional actions.
Well, I have already canceled Thanksgiving with my family, so I urge everyone to do something similar. Sorry, kids running through the room. Even though we're basically isolating, my parents are basically isolating, feels safe, but just cutting any possible risk of especially transmitting over state lines. We are gonna, Two Broads will host a virtual bake-along the night before Thanksgiving, so everyone can just bake in their own houses separately, but we'll be virtually together. So I'll put information out about that. And I think anyone who is really sad that they can't be with family at Thanksgiving, and I'm very sad that I can't be with family at Thanksgiving. If you need help figuring out how to set up a virtual dinner or something, I am happy to help people with that, because that's what we got to do. I've been looking at sort of the winter ahead with this sort of like, it feels like a tunnel that's closing in on me, but we'll find ways to get through it and to have fun, and we have to do this.
I remember when I was first in medical school, it was coming up to the time when I had clinical rotations, and I was really anxious about the idea of working over holidays that I'd always spend with my family, about spending them in a hospital, and how different it would be and how hard it would be to not have that time with my family. And it is hard, but it's doable. I've done it. I've worked a lot of Thanksgivings. I've worked a lot of Christmases. I've worked a lot of New Year's Eves. I've worked a lot of 4th of Julys. And just know that you're making those sacrifices, just like the healthcare workers are making those sacrifices every single year to take care of people that have to be stuck in the hospital at that time. You're making those sacrifices as an investment in future years with your family.
And if we can all really shut this down and get things under control, then in July we'll just have Christmas. I will Christmas in July. Let's just move it to then.
I'm in.
All right, Dr. Emily Landon, thank you so much for everything you've been doing. Thank you for keeping me calm for the past however many months we're at here now, 8 months or so. But thank you also for speaking with me today.
You're welcome. Anytime.
All right. So goodbye, everybody. I'm going to post some links on our website along with this episode for other places to find information and just stay home.
Thanks, Kelly.